Well, pleasure to meet everybody. I know we had met a few of you guys out at SHRM this year, but we've got a few new faces here. If we didn't get the chance to meet at SHRM, we've got myself, Brad Schleier. I'm the VP of Sales. We've got Rian Wendling, who is our VP of Solutions here, and then we also have a few other team members joining. So really appreciate everybody jumping on, and I'd like to keep this simple. From your company's perspective, you're already investing a lot in your benefits, different health programs, and what we call point solutions. I think the biggest challenge there is all of that tends to live in different places. So different apps, different portals, different programs, and it's not always clear how to actually use them when something comes up. So even though there is a lot available, it doesn't always mean that it's getting used the way it should. And really, that's exactly where HealthBook Plus comes in and what we're solving for. So what we are is a platform that's going to connect your benefits, your healthcare, and all of those point solutions your company already provides into a single app. So think of it as a front door, one place, not five. So you can connect all your medical records, labs, medications, even wearables, and brings everything together so you can actually see a full picture on one spot. And then Page, which Rian will walk you through, is going to be your built-in health guide. It's going to help navigate you. It looks at the information from your benefits, and then it really is going to help guide you to the right care using the benefits that you're already providing to the employees. So instead of bouncing between apps or trying to figure it out all on your own, answering a ton of questions based around the benefits, you're going to be able to open one place and really get direction. So think of it like getting the right care at the right time, using the benefits that your employees already have. And from your company's standpoint, I think the goal is very simple. It's how do we make it easier for you to actually use the benefits that are already there to further support you. And just to be clear, this isn't just a wellness app. Really, at the end of the day, this is about making your healthcare, your benefits, and all the programs all work together. So you're in control of what you connect. Your data stays private, and it's built to make this whole thing a lot easier. So what I'm going to do now is I'm going to hand it off to Rian. He's going to walk you through what it looks like, how simple it is to use. But without further ado, I'm going to hand it off to Rian.
Yeah, I really appreciate it, Brad, and thank you all for being here today. I'm really excited to show you all HealthBook Plus and the major impact that I believe that it can have on your employees and how they're able to better navigate not only their health, but also their benefits. I can tell you kind of from firsthand experience that despite the fact that I've been in healthcare my entire life, I'm still regularly confused about where I'm supposed to go within the healthcare environment, when I'm supposed to go there, what benefits I have that are related to my health or even my general benefits. And so just being able to navigate all of that in a single place and then be pointed out to any other solutions like Brad was talking about can really help individuals to feel like they're well supported, well connected, and able to really navigate obviously with HealthBook, their health, but then also those other factors that obviously are so important in their day-to-day lives as well. And so really from the health perspective, HealthBook was originally designed to be able to centralize people's entire health journey in a single place. And so we recognize that people are out there having healthcare visits out in the healthcare environment. They've got all of these records that are floating across all of these various health systems. And then on the other side of the coin, they're also investing in all of these wearables or connected medical devices. But all of this information is just living in these scattered places. And therefore, it's really difficult for an individual to really be able to grasp what's going on in their life and their health. And so originally HealthBook was really built to be able to bring all of that into a single place. And then of course, in the age of AI, once you have all of that information in a single place, you can start really delivering value to those people and insights and help them navigate their health, their health care. And now with the new movements that we're making with the employers and in partnering with employers, really helping them to layer in those benefits questions that they might have to this complete picture. And so the way that you see this throughout HealthBook is there's kind of this push and this pull that you'll see throughout the application. There's times that Paige, who's our AI health assistant, will really push insights to you and as an individual. And so you can see here mine from today. Every single time that I log into my application, I receive a key observation on my health. And so this can be things that can kind of be very, this one's not quite as critical, right? But really insightful as to what's been going on and in my health and in my day-to-day life, and potentially providing me with some insights on things I might be able to improve to deal with what's going on in my day-to-day life a little better. We call them aha moments at HealthBook, but I got a aha moment a year ago. I've had, and that was weird. I've had a vitamin D deficiency on my record for years and years and years. And every single time I go into a healthcare environment and get labs drawn, they mention it. And for years, I had no idea why it might matter in my health. But I think it's just really illustrative of the power of this kind of system, in that about a year ago, I was just journaling that I just seemed to be sick nonstop for the prior months and months and months. I was really low energy. I wasn't feeling good because of how much I was getting sick. And of course, that probably was affecting my performance as an employee as well, right? Healthy employees that feel good are productive employees. And Paige came back one day and said I'd been journaling and just documenting how bad I was feeling. I think I said, my wife never seems to get as sick as I do, and she recovers way faster than I do. And sure enough, the very next time that I log into my app, Paige was able to point out that, hey, there's been some clinical studies recently that show that severe vitamin D deficiency can actually impact your ability to recover and fight off respiratory infections. This could help explain why you're really struggling with your immune system. This is really something you can talk to your clinician about, and here's some lifestyle-based approaches that might help you combat this issue. And so in this one moment for me, Paige was able to bring together all these various things that were going on in my health and my life and give me an insight that really helped me take better control of my health and make steps towards feeling better. And I can tell you, since then, and me taking vitamin D supplementation more seriously, getting out in the sun a lot more intentionally, I've been feeling a lot better. And so that's really a very basic, I don't have a complex medical history, but even that one thing made such a big change for me. And you can imagine if somebody's there managing complex medical conditions, the power that having this kind of a companion with you on a day-to-day basis can really have. And of course, like I said a minute ago, the better that people are able to manage their health, really the better employee they're going to be, the less stressed they're going to be, and the better supported they're going to feel within their day-to-day environment. And so that's just one way that Paige can be incredibly useful. Um, what we do with employers typically is we'll take all of your information on your benefits and we'll train Paige on all of that. And so now at any point, if an employee has a question about their benefits, about their health, obviously we centralize all of their health records and all of their health related data. And so if there's things in there that might be related to a benefits question that they're asking about, Paige is aware of all of that. And so now this becomes the central spot that people can interact with Paige, ask any questions, instead of you receiving, 30 questions all asking about the various health plans or details or who do I call or where do I go or what website is it, what portal is it, all of that. Paige is aware of it, and she can help navigate and take some of those first and second order questions off of your plate, and really, like I said before, make people feel like all of this is actually containable, controllable, because even those of us that are in healthcare, it's really difficult to make sense of all of this stuff and keep it all straight. So Paige is there to always provide them with support. And really the potential of the types of questions that Paige can help with are borderline endless, right? Obviously, she can help people from um, a health related question standpoint. I mean, for instance, for me, you'll see throughout my app, I had an ER visit back in December, and coming out of that, she was really able to help me figure out what I should be doing to continue feeling better after that. And so she could take these pure health related questions. But something else interesting with that is then after that visit, and getting the bill back from the hospital, she was even able to help me look over at the billing that they did and look at my bill and determine if that was appropriate. And so, not just pure health questions, but also, billing. She can help make sense of explanation of benefits. She can help make sense of, what's covered in my health plan. Where do I need to go? Who do I call? So all of that can be handled by Paige. And another really incredible feature that's kind of related is all of those point solutions or services that you've spent all of this time curating and being able to put together this package for your employees that really can help them in their health or in their life in general. All of that can be loaded into our hub here. And this Paige becomes aware of everything that's in here. She's trained on everything in here. And then, very similarly, as I'm talking to Paige, if she sees, oh, you actually have a service available to you that's provided by your employer that could help you out in this situation, she'll actually pull them across into these services. And at that time, those individuals can make use of those services at the appropriate time. And so you've spent all of this time, all of this effort generating this incredible benefits package. But if no one knows that it's available, especially when they're in the middle of something that's going on, when they might not, have the time, or maybe it's a little ways away from open enrollment, it's really difficult for people to, recall that and bring it back up. But Paige is always there ready to help them and to assist them. And so in the past, we've seen this, things that we've had in here, AI musculoskeletal platforms, cancer support programs, smoking cessation. Because Paige understands this person at such a core level, she's able to direct them to those services that might be most appropriate to them at the appropriate time and proactively. And so, really, we see this improving utilization in those programs, which of course then all of that ROI that's being promised to you by any of those point services, you're actually going to be able to deliver that ROI instead of it just sitting in the background that you're paying for it. So incredibly powerful there. We also have the capability for individuals to document how they're feeling. And this, like I talked about with my vitamin D story, this really just provides Paige with the context to really further support this individual. And so, although Paige hasn't necessarily been designed for any one thing, it's been really incredible to hear some of the stories of how people have been supported by Paige in the various things that they're going through on a day-to-day basis. One such example is we've got one individual that had actually lost a family member and was documenting how they were feeling day to day. And Paige was actually able to help support them on their mental health journey and understanding the difference between grief and depression. Am I getting better? Am I feeling better? And of course, all of this ties right back into their life at work as well. And so this could be just such a great support tool that also provides really valuable context to Paige to then be able to direct people appropriately in their journeys. And just kind of going back to that ER visit, for instance, I had been documenting how I'd been feeling in my journal, and Paige actually suggested an instant health check for me at one point. And so it kicked me into this tool that we have, which I was able to come in here and document everything that I was experiencing. I'll just put kind of a fun, simple example in here, but in my case, it wasn't fun or simple. And it goes through and allows you to put in, answer some questions. And you can see this takes, 30 seconds. And the incredible thing about this is it will direct your employees to the appropriate forms of care at the appropriate time. And so for me, in my situation, it directed me to go into urgent care initially. And so initially, it was really looking to support me appropriately, but also, don't go straight to the emergency room every time you've got something going on, right? So potentially make use of those virtual options that your employer has for you, or make use of your primary care. If it is a little bit more serious, maybe it's going to push you into urgent care. But then, of course, if it really is that serious, it will push people over into those emergency services that they need. But we've actually seen and been able to demonstrate a 40% reduction in ER visits, because no matter how much people are educated on the appropriate use of medical resources, when you're really struggling with something, a lot of people just immediately go, it's time for the ER. I need support. I'm going. And this can really help to step in at that critical moment proactively. Paige will deliver this to people. And then that can obviously reduce considerable costs for you in keeping people in the most appropriate forms of care and getting your employees the support they need, while also avoiding those costs that are often excessive for a given situation that somebody's experiencing. Throughout this, there's kind of a lot of additional tools and resources for your employees. We've got personalized nutrition assessments that'll be delivered to them, anxiety, depression assessments, preventative health checklists. It really just becomes that centralized spot that people can go for everything that's relating to their health, and now everything that's going on with their benefits as well. And so, like Brad talked about earlier, it's that front door that then they can be redirected to appropriate point solutions, their benefits, their health care, the system, wherever they need to go. This becomes that first step in the process. And I am going to switch over here. We just launched a brand new feature in the last month, so I'm going to switch over to a different account here so I can show you all this. One of the things that we've been hearing is that people have built these incredible programs for their employees, but getting usage out of them and making them feel personalized to each individual's journey is really difficult. And so what we've done is we've actually built a feature that we call Journeys. And what this will do is it will, just a second, it will actually provide you the opportunity to deliver those journeys in a highly personalized way, which you'll see out to your employees. And so let me get shared here. And instead of this being a one size fit all program, you can imagine your wellness program being delivered. You can imagine, your steps challenge, even something as simple as that. Instead of it being this very static experience for your employee, it's now this very collaborative experience that they get. And so any kind of resources or programming or anything that you really need to push out to your employees or that you're trying to get usage out of, we can build it into Paige. And the great thing about this is Paige then delivers it. So in this case, it's a video on the pillars of lifestyle medicine. I'm then able to really engage with that content within the scope of my own health or my own journey. And so I can ask follow-up questions. Paige is right there to support me. And all of this is fully adaptable to my own health data, my health history, my health records. And all of that is living there waiting for me. And so it takes this very flat experience in traditional programming and makes it highly personalized and much more adaptable to the individual, which is really incredibly valuable. One thing I didn't mention previously is because we are pulling all of those health records in for individuals, all of those health records then live with that person and go with them wherever they go within the healthcare environment. And so for me, when I ended up in that ER back in December, it happened to be in a health system that I had never been to before. And they had no idea who I was stepping through the doors of their ER. And so they immediately jump into care mode and they're, getting me into a room and starting to treat me. But it became very obvious very quickly that they had knew nothing about me, knew nothing about my health history. But with HealthBook Plus, the incredible thing, and I'll show you kind of on the clinician side what this looks like here in a minute, is that I am now owning all of that health data, all of my health records in a single place. So I was actually able to share that out to the hospital at the time of my visit. And now all of a sudden they go from knowing nothing about me to having full context of what is going on with this patient. 800,000 events, medical events, serious medical events happen every single year simply because of medical errors due to a lack of diagnosis, lack of context. And so one of the missions at HealthBook is to really cut down on that number and provide people with better care simply by giving them their data and having it in a place that it is always with them, always traveling with them. And so I'm going to switch platforms here quickly over into the back end that we call our portal. And you'll see how all of this data that is being generated on the employee's side, on the individual's app, can then help provide them with a care experience that is really the promise of highly personalized medicine. And so within this platform, you can see that no matter who I'm going to see, it could be a specialist, it could be that I'm in the ER, it could be my primary care. Um, they get an incredible view into what's going on in my health and in my day to day. And that just allows them to provide better care and to really understand what's going on. And so one of the ways that we do that is we've got this recent activity section that will provide them with a quick glance into what's going on with that individual. And so, for instance, if I ended up in another healthcare facility or I went to primary care, they would quickly see that I had that ER visit. They can see my deficiencies still ongoing. They can see what's going on in what we call the point of living, like what's happening with my weight, how is my mood and sleep, my nutrition. All of these things are so important and so foundational to our health that typically are ignored within healthcare. Now becomes very tangible to them, and they're able to treat me as a whole person instead of just whatever pieces of data they might be getting access to. And then similar to the patient side or the employee side, they can now come in here and actually ask any questions about this individual. And so you can imagine for an employee, let's say they have a complex health history, instead of people just needing to treat them based off of what I fill out on a form or anything, they now have this power to come in here and I can even ask, give me Ryan's details of his ER visit from December. And so this just really up levels again the levels of care that people can provide, the amount of context that they can have on any given person. And of course, in turn, this improves outcomes, lowers costs, and really allows people to get the care that they need in a much more personalized fashion. And so you'll see Paige being able to go out, find that ER visit that's within my health book, and provide all of the context of what's going on there in that ER visit. And so not only is there this incredible support that the patient's getting, but we're also up leveling their care on the back end as well. And so high level, when the system's used and people are able to really centralize all of their benefits, all of their health in a single spot, they're really able to navigate things considerably better. And we truly believe, given that employers are so involved through benefits, through the support that they're providing to their employees, through the offerings that they've so carefully crafted We think it's really critically important that that piece of the puzzle is also added into HealthBook Plus, that we can start providing people with the guidance, with the navigation that they need on a day-to-day basis. And the beautiful thing for an employer is it's producing ROI, right? If I'm piecing together all of these benefits that on their own really do have value, but nobody's using them, HealthBook can really be that hub that where people can manage their health and their benefits in one place, but then also get navigated proactively into these solutions that help them, but then also deliver ROI for their employers as well. And so I'll kind of stop there, see if there are any questions in any of the chats. I don't know, Brad, if you've been
Yeah, I've got a few
monitoring.
of them.
Awesome. Yeah, fantastic.
Yeah. So here's one. How can you get better engagement than my current programs?
Yeah, absolutely. So, one of the things that we're really working, obviously, engagement is always, the biggest thing that's critical is that by providing a centralized solution for them, it really becomes that one-stop shop. And so, in having their health plan information, we can build out journeys that walk them through open enrollment to understanding what benefits are provided to them. And so once you get them in there and they're grabbing their ID cards, everything lives in a single place. Once they start seeing that power that page is delivering to them, and their health records are coming in and they're seeing everything, that's really where the engagement starts building on its own. But initially, it's really around, um, you know, usually we try to run some sort of program right out of the gate to get that initial engagement to then be able to kind of churn off of that. And so a lot of times that's open enrollment. Like I said, it can be any of that programming, a health journey, a steps challenge, really anything. And then from there, it just becomes so sticky for people as they see the power.
All right, here's another one. Can we do reporting on our employer population?
Yeah, we absolutely do have reporting. Obviously, being in the healthcare business, a lot of things are very sensitive, and so it gets rolled up kind of to a population level. But things like engagement, we can do some minor outcomes reporting. We're not looking to give you, a deep dive into any employee's health, obviously, but we can do a lot to show that people are getting to the right programs at the right time, the right point solutions. And so, yes, absolutely, we can build out those reports.
Is engagement app only, or can we engage with page without them?
Yeah, so today Page is largely in the app. And so as of today, the answer would be everything's driven through the app. We are working on some solutions to allow her to extend out into some of the other platforms that people are using on a day-to-day basis. Obviously, obvious one is text, but even moving into potential integrations into some of those workforce tools like a Slack, where people could just pop in and out, ask Page questions,
Sure.
is definitely within scope as well.
Cool. And then it looks like we got one more. What does it look like to get onboarded?
Yeah, so it's actually super simple. I did talk about the need for us. We usually work with any one of our employers, and we kind of just take what they have available to them on their benefits. We take on a lot of the heavy lifting in terms of getting that information into the system, getting Page trained up on it. And then from there, obviously, it's about getting the entire employer panel or employee panel in there, and you're kind of off to the races from there. And so it's really quite simple. We handle a lot of it on our end.
Right. Are there any other questions out there? What kind of companies is this best for?
Yeah, it's
It's a
been
great
really
question.
surprising. Yeah, it really is fantastic question. obviously those that are interested in their employees' health and really motivated to make change there. So I'll start there. But it's been really surprising in working with various populations to see that sometimes those populations that you would think um, might not be a great candidate for an AI-based platform, app-based, that they can a lot of times be the ones that do actually latch on to this, right? At first blush, we hear a lot, well, my elderly patients, are they really going to want an app? Are they really going to engage with this? But then at the same other side of that same coin is that these are the individuals that probably need the most support and have the most health records out there and have the most complex situations. And so having that companion for that population really drives a ton of value. And even, we talk about rural populations being really a core driver for HealthBook. It's really not based off of a given profile of what you would think. Yeah, it's been really incredible to see the truck driver in Ohio that can take control of his health right alongside that person in Silicon Valley that's tech all day. So it's been interesting.
Yeah. And I think to piggyback on that, I mean, really a great question. We tend to work really best with any employers who are, they already have multiple programs in place. So, if you've invested in your benefits and point solutions and you're trying to get more value out of them, I think that's really where we fit well. We're not the step one, but we are what makes everything you already have work a lot better. Another question. What if I don't have any point solutions but have been looking?
Yeah, I mean, set this up now, right? Because I can tell you once you have those point solutions in place, it's going to be really critical if you want to get value out of them, that people actually know where to access them and when to access them. We do have kind of a library that we come to the table with a lot of times, and so we can actually become kind of a trusted advisor to some of that because we have worked with many of the companies that are working in the space and some of these awesome point solutions that we've seen deliver ROI. And so we can really partner on that. But I just say, if you're thinking and you're wanting to move in that direction, this is a great kind of foundation to lay to then layer those in on top. And honestly, even if you don't have point solutions, people are still navigating their health, right? They're still waking up with severe stomach pain and not knowing whether they're supposed to go to the ER or into urgent care, or maybe I can just wait and call my primary care tomorrow. So there's so much value that Page can deliver, without this, crazy benefits package. But obviously, that proactive navigation into those point solutions can also really drive engagement and ROI as well.
Looks like that was the last question that we have so far. Ryan, do you have anything else you want to add?
Yeah, no, absolutely. I would just add we're super interested in any conversation. So if you want to hop on the line with Brad or I or any of the rest of our team and just kind of chat through how this platform might fit into your unique situation and how we believe we could help your employees find, their best version of their own health, that's really what we're motivated by. And I would definitely welcome any of those conversations. So please feel free to reach out and definitely look forward to talking with many of you.
Yeah, awesome. So, well, we'll wrap it up, but really appreciate everybody taking the time today. If there's one thing to really take away, it's this. You've already invested a lot in your benefits and your different programs for your employees. The challenge isn't access. It's making all those benefits and those point solutions that you have easy to understand and actually easy to use. So that's what we're solving here. At the end of the day, it's really about helping your employees make better decisions and get more value about out of everything you already have in place. So if you have any questions, feel free to reach out. We're happy to help however you guys need. Really appreciate the time, and thank you everybody for joining.